Welcome back to Firewash.
As members of the Bedford Heights Fire Department, we're asked to do a lot more than just put out fires. The role of a firefighter-paramedic has changed dramatically over the past several decades. Within the city of Bedford Heights, we're asked to respond to all types of emergencies, whether they're fire-related or medically related. Here to tell you a little bit about our Advanced Cardiac Life Support Rescue Squads is firefighter-paramedic Nick Bacco.
Hi, it's Nick from the Bedford Heights Fire Department. Today what I'm going to do is I'm going to take you through the Emergency Medical Service segment, or EMS segment of the fire department. Here at Bedford Heights, we operate 3 ALS, or Advanced Life Support Ambulances. Here we are in the back, or the patient care area of our ambulance. This is where we do the treatments to the medical and traumatic emergencies that we encounter. If you look around at our cabinets, you'll see that we have a vast array of equipment and supplies. This is the bag that you'll see us bring on every call we go into. It is always with us and rarely leaves our side. What this has is a variety of bandaging supplies. We have scissors, tape. We also have a glucometer here. This is used for checking a patient's blood sugar through a small prick of their finger, virtually painless, and we acquire a small drop of blood to get that reading. Our next compartment here, we have, this is called a pulse oximeter. It is basically the same thing that is on our heart monitor, just a portable version. In this compartment over here, we have a stethoscope and blood pressure cuff, obviously for taking blood pressures. And then we have a larger inner compartment. And in here we have a portable IV kit for starting IVs to give fluids and medications. We have a bag valve mask that is used for breathing for patients should they need it. And we also have an intubation kit which is used in conjunction with our bag valve mask. This is our heart monitor and defibrillator. What we use it for is we use it to monitor a patient's the electrical rhythm in their heart, as well as defibrillate or shock, as you've seen on TV, any rhythm that may be very harmful to the patient. Now this piece of equipment serves several other functions also. It is able to take blood pressures for us and also monitor the amount of oxygen that's in a person's blood. This is a very valuable piece of equipment for us. It's one that we use extensively, and it is probably one of the most important pieces of equipment that we are able to use. What this is a backboard, and it's used to secure a patient in the event of the possibility of a spinal injury. The first thing that we would do is we would place what's known as a cervical collar or C-collar on the patient. And this goes around the patient's neck, under the chin, and what this does is this will stop the person from being able to move their head backwards and forwards. The next thing that we would do is someone would always be controlling, known as what's controlling C-spine, controlling so that the patient cannot move their head at all. And we place what are known as head blocks on either side of the patient's head. And these also totally immobilize the patient's head so that they cannot move their neck at all. We have straps on the backboard and on our cot also. And this just assures that the patient has no way of moving around because, like I said, this is what we use to prevent C-spine injuries or cervical spine injuries. We've also strapped the patient to our bed here using 3 more straps. Yep. We have a middle strap and a leg strap. Now most of the time we do this, it is as a precautionary measure, but it is also very important just in case in the patient's accident that something was jarred around there that's not supposed to be. And it is very uncomfortable, but again, it's everything we do is for your safety.
Thank you, Nick. Coming up, we'll take a look at a dramatic rescue of a 6-year-old boy trapped in an apartment fire.